Hi there. Chances are, if you've landed on this page, you're looking at what the Biomechanics Coach Diploma is all about. And I do get asked a lot of questions. So I'm just going to run through some of the questions that I get asked, and hopefully I'll answer some of yours. If there's any that I don't answer, then do feel free to call me on 07976 933113, or you can email me Rachel, Rachel, at biomechanicseducation.com. So the Biomechanics Coach Diploma has been in development for many years now, and it recently evolved over the last year in response to requirements from our learners. And so it is now 5 two-day workshops. The first 4 two-day workshops need to be completed before the 5th one. However, they can be completed in any order at any venue, as long as all 5 are completed within 24 months or 2 years. The final module is the one that has your practical exam, which is why it's the one that needs to come at the end. So the first 4, what are they all about? Well, each 2-day module will give you a series of assessments that you can do on your clients, your participants, to understand how they move intrinsically. So the first module, or module 1 as we call it, is all about pelvic biomechanics. So you'll learn how to assess leg length along with pelvic function, both in passive for the client and standing, so they're active. And also we look at a test in the spine for QL, or quadratus lumborum, and how that might relate to pelvic function as well. After those 2 days, you'll go away, you'll have a period of time where you can practice those skills. And then the second module is spinal biomechanics. So we assume by this point your client has a fully functioning pelvis and the muscles are released through the lower spine as well. And we teach you how to assess the sciatic nerve, which could also relate through to the pelvis and the spine, and also the mobility of the spine, before we start looking at the 3 steps of stabilise, what we call the stabilise phase. Step 1 is all about assessing the capacity in the spine just in basic neuromuscular progressions. Step 2 is from Stuart McGill's work, looking at the isometric core ratio strength tests, and have we got a balance through the ratios of flexion extension, right and left side. Once we've achieved those, step 3 is looking at aberrant gross lumbar motion. It's a bit of a mouthful. That's looking more at functional stability. We look at hinges during squatting, and we also look at cross-pelvic syndromes, or the ability to control spinal torsion through asymmetrical loads. So that module certainly sets you up for a base throughout what we call our pyramid. So it's level 2. Pelvis is level 1, stabilise level 2, or normalise level 1, stabilise level 2. And then we have functionalise, which comes into module 3, looking at the shoulders. So we're going to teach you 4 assessments for muscle spasm in the shoulder relating to pec minor, subscapularis, infraspinatus and the upper traps, common areas for dysfunction. And we also look at 3 nerves in the arm, the most important one being the median nerve. That can often relate to carpal tunnel, and if we don't look after it, can result in that problem. And we also discuss the radial and ulnar nerves. However, the way we look at those would be similar to the median nerve. Functionalise also expands into module 4, which is looking at the knee and the foot biomechanics. We have 4 screens for the knee, looking at ligament dominance, quadricep dominance, and also leg dominance, so the balance between left and right. And then when we look at the foot, there are 6 foot function screens. So we break that down really simply. Clearly, we're not going to be teaching people podiatry here. We do still need those guys to support us and help us. However, having a basic idea of foot function will enable us to understand at what point we do seek their help. How much is ascending and how much is a descending problem, potentially to advise on footwear. Once all 4 of these are complete, you basically have the whole screening system in place. And what you come back for on the 5th module is a day looking at low back pain, understanding clinical conditions that can affect low back pain by looking at the anatomy of the spine and the ligaments and the discs, how they relate to each other and what their job roles are. We also look at MRI screens and MRI reports, which can get quite interesting when you're trying to understand what's going on. So clearly we're not giving you a clinical qualification, but we're enabling you to understand what clinicians see and look at to understand how better to communicate and work with them. There's also a section at the end where we look at manual articulations of the spine. So sometimes exercise is not enough to create even load through the spine when you're trying to ask a client to move. Their mobility may be stiff at one point, and actually when they're doing the mobility work, they're just not moving around the stiff area. So some manual help might be needed. You do, of course, need a manual therapy qualification to use those techniques, but it is a good place to understand how they're used. And it helps us as well to communicate with those guys when we're maybe cross-referring clients. After you've finished all 5 modules, you then have the opportunity to go on and gain your qualification, for which you need to complete 4 case studies, and you need to screen them 4 times each. So we do require that as the minimum. However, we expect you to do much more. Some people will drop off, maybe get an injury, move home, or just not adhere to the programme. So for you to be successful, really, we need to get more clients through the programme. It really isn't onerous, by the way. You're just going to be doing with them what you should be doing anyway. We give you all the paperwork to make it easy to fill out, to give us the information we need. And the final piece is a 2,000-word overview of all of your experiences. So that 2,000 words encompasses all your time through the course and your case studies as you work with them. It will include also any other skill sets you have and that you may have applied to improve the way your clients move. That's always interesting for us. If you do pay for your modules in full up front, you do get 1 year's free membership with the IBA. So if you go back to the bar at the top, you'll see a drop down for events and membership. If you click on that, and then you'll see that the IBA membership is down at the bottom on the right there. If you click on that, it'll tell you all about that and what you get. You get t-shirts, you get free CPDs, etc., and a huge amount of support way beyond your qualification. If you still have any questions about the Biomechanics Coach Diploma, again, feel free to contact me. We have a couple of venues down in London, North London School of Sports Massage, and of course the wonderful Loughborough University. So go and have a look down the page. You can buy there, or of course, if you wish to pay as you go, there are buttons to pay for each module as you go, and you can spread it out.